Nursing homes were established in the 1800s when women and church groups began to establish special homes for elderly people. Today, over 8 million people use long-term care services annually. These services include short-term rehab, adult day services, long-term care, hospice, home health, and residential or assisted living communities. These types of patients are considered to be vulnerable populations due to their advanced ages, comorbidities, disabilities, and possible social isolation. Due to the due to physical or mental health conditions, about two-thirds of all people 65 or older need assistance with at least one daily living activity, such as bathing or preparing a meal. Most of them require help with activities such as toileting, dressing, bathing, and eating on a daily basis. When faced with being an older adult in a long-term care facility, these can range from having to wait to go to the bathroom or waiting long periods of time for their medications. The amount of assistance needed from other people increases quite significantly for the elderly in these nursing homes. Other issues affecting the population include depression, cognitive declines like dementia and Alzheimer's disease, pressure ulcers, sleep disorders, falling, and different forms of abuse. Patients in long-term care have many risk factors that make them a vulnerable population. Most residents of a nursing home are typically there because of medical conditions and comorbidities that they are dealing with. Their advanced age increases physical and mental declines naturally. Long-term care facilities unfortunately, are known to have an increase in social isolation for these populations. Of nurses and caregivers that limits their time with interactions from staff. The discontinuity between the high ideals of nursing education and real-world practice is a major cause of frustration, moral distress, and burnout among the youngest, and pushes up to half nurses to change their career within 2 years. These conditions are insinuated in the care of the elderly patients with multiple chronic needs. With diminished health already, the elderly adult in a nursing home has an increased risk of medical emergencies. It takes a very skillful nurse with critical thinking to be able to identify medical emergencies as they develop. Integrated care. The geriatric population living in a nursing home keep their allocation to primary care team in their geographical area where it belongs. Nursing homes are required to provide enough staff to adequately care for residents and regarding the health teams of the nursing homes. These are a group with a high number of professionals that do not belong to the public health system and therefore do not make use of tools it has to ensure the continuity of care for residents. They go on to state that it takes use of all medical tools and knowledge to care for nursing home patients and strengthen the care provided. This would include recognizing medical emergencies and attempting to prevent them ahead of time. In a recent study, a resident had a known heart condition, and a general practitioner would have probably handled it differently. But as an emergency room physician without information about the patient, a hospital admission was the only solution. Furthermore, the observation material showed limited continuity in the nursing homes due to low physician coverage, especially in long-term nursing homes. Some physicians had arrangements with the nurses to be available by telephone in the afternoons and on weekends in the hopes of preventing unnecessary hospital admissions. But with the issue of limited staffing and lack of patient history, knowledge and emergency room visit cannot be avoided. Nursing home residents who transfer to the emergency departments can pose many problems because they consume substantial healthcare resources at the time and later, and their sometimes complex and multiple needs often do not have a quick fix. About one-third of all general hospital beds in Norway in 2006 were occupied by patients above the age of 75 years old. Patient gaps occur commonly when elderly patients are transferred from a nursing home to the ED. A recent study showed that standardized transfer form was associated with a limited reduction in the prevalence of information gaps even when the form was used. A large percentage of the transfers were missing information. It was also determined that the lack of descriptive detail regarding the presenting problem was common. Emergency staff require important clinical and personal patient info to provide quality care. International studies shows that documents and handover deficiencies are common. Emergency care in long-term care residents is quite important and almost unavoidable. With comorbidities, lack of staff, lack of continuity of care with knowledgeable staff, and lack of communication with ER transfers, medical emergencies become of specific interest for our long-term care residents. Our jobs as advanced practice nurses is to be advocates of the elderly population in nursing homes and improve their quality of life by working towards improving their physical and psychological well-being. Not only should we be advocates for them, but we also must educate other clinicians to be able to recognize signs and symptoms of their risks and vulnerabilities. Doing this will ensure that everyone in the facility can be more knowledgeable on this vulnerable population and hopefully prevent any negative outcomes.